Hi, Grant Garcia here from Seattle, Washington. Today we're going to show our technique using the 1.5 FiberStitch to repair a red-red junctional tear of the medial meniscus. We're also going to show our new technique to tension them by hand, which allows it to be slightly tighter. Here we have a left knee. You can see we've marked the fibular head. This is the lateral portal. This is the medial portal. Today we're going to show a repair. It's a pretty common tear, undersurface medial meniscus tear with some subluxation. So we'll show you how we repair this with the new 1.5 FiberStitch. And today we're going to show the panoscope. I actually like the pano mode that we're in. You can see a little bit better with this. So we're going to go through the medial portal. I've already created this portal. Since you have the sled, you don't need to do a passport cannula, but you can do that if you want a little bit more working. This undersurface tears at the red-red junction. You can see subluxation of the meniscus. Using these newer FiberStitches, the 1.5s, it's much easier to get a vertical mattress, which is shown in a number of biomechanical studies to be a better repair. You find it tends to be more difficult to do the vertical mattress in medial-sided defects or medial-sided meniscal defects. And so these type of stitches, the trephination, again, you can go through multiple pokes or you can go through a single poke. A lot of times you'll see the needle come out, so you can see here, and then you'll slowly feel the MCL pop. There is no long-term concern by doing this. And again, many of these are going to be in braces, so they end up having no issues long-term. I like the torpedo, and you place the torpedo shaver in there. And then what you're going to do is just slowly rotate your hand and clean off any of the undersurface to get some debridement. And then if you need to, with the torpedo, you can sneak underneath the condyle and then clean the back area as well. All right, so now we're going to perform our repair. So we're going to put the sled in. And the nice thing about the sled is it protects the condyles and doesn't have any soft tissue impingement. So when you're placing this FiberStitch in, you want to place it facing down so you can more easily slide it in. And then you're going to remove the sled. And I like this angle, so I'm going to place our FiberStitch in. So we're going to place it in. You can feel it going all the way in the back. And if you have to rotate up because it gets a little bit tight, you can feel it moving quickly. So 1 click, 2 clicks, then you're good. You've passed it through. And now you want to carefully rotate it out. And you don't want to be too aggressive. Again, this only takes a few seconds. Perfect. And then we've passed it through. And now we've gone all the way through the tissue. And now the really cool thing is maybe give a little bit more force. Perfect. Now watch this. You always able to go above. That's really hard with the old options. And now we're going to go through as well again. So we're going to hit the back. And then we're going to fire. Good. And if you get a little bit of tension, you can just rotate around. And look, it's super smooth. So I just did a tiny bit of rotation. And then we're going to do another click. And then we're going to, again, remember, slowly rotate out. Perfect. And now we're rotating this out. And then we're going to come out of the knee. Perfect. And then one trick that's really nice is before you do anything, just grab all the sutures and pull. And you're going to lock in the back. Okay, so now you can see me holding this. So what we're going to do, I'm going to show you my technique. So what we're going to do is take 2 fingers through here and watch on the screen. You're going to find the one that needs to be tightened. So now I'm going to tighten it. Good, so it takes a little bit of slack out. And it's amazing, you can really pull, and they're strong. So now you look at this, we've tightened it a lot. And so every time I'm tightening, and then it's pulling back. Tightening, and then I'm pulling back. And so then now we feel good about our tension. So I'm rotating my finger, you see this? So now you have max tension on there, and then I'm gonna let go and just slowly pull this down. Boom, there you go. Perfect. Again, we're going to repeat exactly what we did. So here, tip aiming down on the sled so you don't go into the condyles. Once you're in, remove the sled. And then the same sort of thing. So we want to flip this meniscus back on itself. So because of this nature of this anchor, this device, it's really impressive. You have that upward angle. So I'm all the way in the meniscus. And you're going to see really smooth. 1 click. 2 clicks. Awesome. Okay, now we're going to rotate out really slowly. And the key is this rotation. Don't just jam in and try to pull it out. Just a few extra seconds of patience. And now the nice thing about this is I can get an amazing vertical mattress. I'm going to flip down. You see that? Over the condyle. Boom. And then we're going to fire it. Really smooth again. Really smooth. And we're done. And now we're going to go back and forth. And now we've removed this. And you can see that by the smaller needle tip, there's way less penetration of the meniscus. So we're going to repeat this again. So watch what I'm doing. So 2 fingers in here. We're going to do a little bit of counter pull first. And this is going to set the anchors. And then you're going to find the anchor that slides better. Boom. Watch that. I just took out all the slack. And I'm going to counter back and forth. The nice thing is, you've seen this in studies, the pull-out strength of these is really impressive. And so you can be a little bit more aggressive on this, like that. Perfect. Don't be afraid to give it a little bit of tension. You really want to get a good repair. And then you just pull it down. And look at that. Okay, so you can see here we have our final fixation of this medial meniscus red capsular tear. We have 3 fiber stitches in here. You see we're able to utilize both the superior and inferior portion because of the size of these stitches. This is a really impressive construct. You can also see, you may notice my view is a little better than average, and that's because we're using the panoscope. We're actually in sort of 45-degree mode. So right here, you can see all 3 stitches are really well placed. There's excellent tension and no further subluxation of the meniscus. I'm incredibly happy with this. This patient will be started off just minimal non-weight bearing, and we'll get them moving pretty quickly. We have robust fixation, so I have very low concerns for that.